My name is Paige Ribeiro Agard. I live Trinidad and Tobago. Ayana Diot. She was my aunt, a 32-year-old young lady. She was a star. She really, really gave her all. In January 2018, she was diagnosed with stage 4 cervical cancer. In a matter of 5 months, she passed away. Never did I think she would die from cervical cancer.
My name is Moira Lindsay. I work at PSI Caribbean, and I am the executive director.
PSI, or Population Services International, is a global nonprofit that is dedicated to improving the lives of the women and families that we serve.
The HPV testing pilot is really part of a larger, comprehensive cervical cancer prevention project. We are looking at 2 main areas: increasing the uptake of the HPV vaccine and increasing the uptake of cervical cancer screening. We had a unique opportunity to access innovative technology, which would be a HPV testing machine. And we approached the Ministry of Health to see if they would be interested in working together with us.
I'm a member of the Maverick Collective, and the project I'm helping support focuses on screening, preventing, and treating cervical cancer in Trinidad and Tobago. I see the biggest challenge in terms of us achieving elimination of cervical cancer as being public awareness. I think that not a lot of people throughout the entire world are aware that this cancer is preventable, it's highly treatable, and the way that ends up playing out is that largely it's in developing nations that the disease burden is higher. And so to me, that also makes it a disease of inequity. People are dying of this needlessly when we know how to prevent and treat it. And so I think that public awareness is one of the missing puzzle pieces.
We have patients, when they come with us, they diagnosed at already a late stage, end stage cervical cancer. We want to have this diagnosed before, possibly even prevent cervical cancer. We want to be able to pick it up when it's at a treatable stage, but that's not where we are right now. We are actually getting end stage cervical cancer patients.
Trinidad, like most countries in the region, relies on the use of conventional pap smears. And we knew that there were newer technologies that were already becoming quickly available for low and middle income countries that we wanted to offer to them so that they could have a sense of what it would take to transition from pap smear to high precision molecular testing or HPV testing. Trinidad, of course, is a relatively small country. And so we knew that if we had a model that was effective here, that we could document well and understand what it took, everything from policy to service provision to advocacy and consumer awareness. If we could get all of those pieces of the equation right in TNT, then we could think about scaling that in other places where we saw similar opportunities lining up.
Trinidad and Tobago had the privilege of signing on to the January 2019 document signed at the World Health Assembly with respect to global targets for the elimination of cervical cancer as a public healthcare burden for the year 2030. The Ministry of Health cannot do it all. Therefore, by doing a pilot project, we can look at the economies of scale and look forward to scaling these projects.
The global targets for the elimination of cervical cancer is 90, 70, 90. 90% of girls to be vaccinated with the HPV vaccine by the age of 15 years, 70% of women to be HPV tested by the age of 35 years and 45 years, and 90% of women identified with cervical cancer disease to receive treatment and care.
PSI Caribbean embraces the idea of working through partners. We strongly believe that we cannot do this work alone.
Here in Trinidad, the HPV testing pilot has been a success really because of the trust that we've created with our ministry partners. So in my mind, it's a really nice example of PSI having the flexibility and the resources to be able to support a government to take on a new technology in a small scale way and let them think really about the larger scale.
I think if Ayana had access to HPV screening, she'd be alive today.
Cervical cancer is unfortunately a space that's underfunded. It is a space where we have some pretty big potential wins, and WHO has come out with a global elimination agenda, which means they believe it's possible, and so do I. I would really like to see people moving funding to this work. We really could see a generation that's free of cervical cancer. It won't happen overnight, but it can happen.